So what's Primary Care Services North Cumbria all about? Welcome to part 4 of our 5-part series. Part 4, How Primary Care is Evolving. A wise person once said the only constant in life is change, and that feels particularly true of our modern technological landscape. Whether this is for better or worse, we see many things moving towards or already moved onto online options, and an upcoming generation that will never have experienced phone boxes, dial-up internet, rewinding tapes, or actually having to wait for the next episode of a TV show. Demand and expectations are often high. With these things in mind and looking at the world of health, we also have people living longer with more complex conditions to manage and higher demand across the system with the resources available. So services within primary care have had to evolve as well. A common complaint is that people can't see their GP. However, the teams at surgeries have developed to have become a wider team of specialists and professionals available to support patients. Your general practitioner GPs are still at the heart of surgeries and approve the patient pathways, but you might be better suited with a more specialised member of staff to support your condition or need. Also, receptionists and care navigators are highly valued members of the team, who aren't trying to be nosy or awkward. They're asking you questions from pathways from your doctors, and this is actually part of modern general practice contracts. The information gathering helps the categorization of patients to allow for effective clinical triage by the most appropriate person. They're working to get you to the most appropriate medical care. So treat them how you would like to be treated if you were doing the job. We understand things can sometimes be frustrating, but practices will not accept abusive behaviour. Remember, they're often dealing with unprecedented demand, so your patience and politeness is very much appreciated. We also understand that some people can't or do not wish to access things via online options. But if you are someone who uses online services for things like social media, shopping, holidays, banking, emails, bills, gym classes, doorbells, video calls, maybe you could consider adding health options into the mix as well. Change isn't easy, but using these expanded solutions by people who are able to will help your local surgery in their response to these increasing demands. In part 5, we'll be looking at our social media approach.